your doctor says, you need a foraminotomy. You're like, what is that? What is he talking about? It doesn't make any sense to me. It's very simple. A foramen is a hole or opening, and our nerves in our spine leave through these holes. They exit. A nerve leaves, like my fingers, at every foramen or hole out of the spine. And sometimes the foramen can get tight or narrowed. So I'm going to put this pen in. This pen is your nerve. And if the hole gets tight, it'll pinch. Do you see that? And if it pinches the nerve, it can cause nerve pain. And if I'm going to do a foraminotomy, that just means I'm going to open the hole and make it bigger to take the pressure off your nerve. So it's usually a minimally invasive surgery, opening the foramen or the hole to create more room for your nerve to get out without being pinched. Very simple.